Hi, Jessica.
Hi, it's so good to be with you.
It's so good to have you here. We have so many things to talk about and to get into. Um, Very excitedly, I opened a piece of mail recently, and it was your new book, Normalize It.
Yay.
Yay, which is your second book, which is amazing. Congratulations.
Thank you so much.
And your first book, I Had a Miscarriage. I want to start there, but I also want to say that we were actually supposed to talk at some point over the time between that book release and now. And literally, when we were supposed to talk, you were like, well, I'm waiting on news from my doctor. I'm sure it's nothing, but it might be breast cancer.
Hmm.
And I think it was that day you actually did an Instagram live with me
I
and you had
know.
just been diagnosed. And I was like, we can cancel. And you were like, nope, I wanna do it. I
I
need the,
know.
so can we start
I wanted to
there?
try.
You're amazing for doing it.
No, that's so interesting because I knew we were speaking today. I went and looked up my diagnosis date because I remembered that. And I just can't believe that it's almost 4 years ago exactly. It's this month.
Yes, yes, 4 years ago.
four
So
years ago.
now,
My
when you got that diagnosis, you had already finished your manuscript of I Had a Miscarriage.
Oh yes. Okay. So my book, my first book, I Had a Miscarriage, a Memoir Movement, came out in the beginning of March of 2021. And then it was 2 weeks later, I had scheduled a routine mammogram. I had felt something. I had skipped my mammogram the year before because of COVID. So I was waiting until I got vaccinated to be able to go in. And my OB had felt it and she didn't think it was an issue, but she said, of course, go do your thing because you need to anyway. And I just knew. I just sort of knew,
Mm.
even though, even though I would never in a million years have predicted, of course, that this would happen to me. I mean, everyone says that about every challenge or trauma or drama that they go through in their lives, probably. Um, but, I'm the first woman in my family to be diagnosed with breast cancer. So it was just flattening. It was shocking. And I do remember saying to you, no, let's talk anyway, because I wanted to connect with you. I wanted to keep talking about the book because it had just come out. And I think I thought that falling into the grief of this diagnosis wouldn't necessarily help me. But then I think I promptly started crying while we were talking.
I mean,
So,
I don't even think you did. You held it together. We kept it brief. And, you and I connected offline after that because I was like, girl, are you okay? And you were like, I don't know. I don't know what I am. You had just been diagnosed and you, in your way, continued to be very outspoken and loud about it, which we need. So I feel like maybe let's start there in terms of I had a miscarriage, a memoir, a movement is a memoir, but it is a movement to reduce the stigma of miscarriage. And that was really what you were known for, what your book is known for. How did
yes.
that serve you in terms of your breast cancer diagnosis?
Wow. I feel very emotional right now.
Sorry.
I wasn't prepared for this. No, I mean, in a beautiful way. I've been doing so many podcasts lately about the second book, and I love how deep this feels and how we get right to it.
Yes.
Um, Nothing could have prepared me for the diagnosis, to be honest. My kids were young. I mean, I guess technically they still are, but they're not in my mind. My son is so much taller than me, and my daughter is coming up on me. So, uh, no, nothing I had done professionally or personally or in therapy or in my writing had prepared me for the prospect of dying.
Mm.
Um, and even though in my first book, I open with the story of my second trimester miscarriage, which could have ultimately resulted in my death because I miscarried while I was home by myself. I had to cut the umbilical cord. I
Mm.
promptly began to hemorrhage. I then brought the fetus in a bag with me to my doctor's office and then proceeded to have an unmedicated DNC. So, with the amount of blood loss, there was this kind of fear, especially on my husband's part. I think I was just like so traumatized, and I felt like I was like in tar. I felt like I was living a documentary. But I think he, looking in on this, was like, am I going to lose my wife and my unborn daughter, both? So that was the closest I had come to mortality
Mm.
in my own body. But this cancer is a different animal
Mm.
altogether. And I never like to, as you probably know from my writing, especially my first book and my second book, I get into this as well. I am not into comparing or contrasting traumas. I think that's a dangerous game. Nobody wins. And everything we go through, because it's our lives, is sacred to us. So if somebody, for example, has a 6-week loss and somebody has a 16-week loss and somebody has a 26-week loss, there can be all this conjecture and sitting around and comparing and contrasting, like who feels worse, and oh, I don't feel entitled to feel badly because mine was quote unquote just 6 weeks or whatever. No, I call bullshit. Like, no, no, no. This is why I'm not a huge fan of support groups for pregnancy loss when they mush them all together. Yeah, because people end up not feeling entitled to their own pain. And I say to my patients all the time, this is your life. This is your loss. It doesn't matter if you think that somebody else feels worse and that, that you don't deserve to feel the way you fully are entitled to the feelings. This is your life. This was what you envisioned as your family.
That's right. That's right. Okay. So, we both live in Los Angeles, and in your book, when you are bringing your fetus to the doctor, you described like exactly where you are. And I just remember reading it and feeling like I was on that street with you and your husband. It's so visceral. And I feel like your breast cancer, once you came out with it, which, my God, the timing, literally your book and your breast cancer diagnosis within the same month. But you also posted a lot of visceral images, thoughts, feelings, experiences, relationship wise with your family, which is really what you're about. And
Mm.
did you already know Normalize It would be the next book, or do you feel like the cancer had anything
Mm.
to do with that?
Oh,
My God,
you're
nobody's
brilliant.
asked this.
I mean, you are just brilliant.
The social clip is gonna
Wow.
be you just saying, "You're brilliant, you're brilliant, you're brilliant."
You make a meme about it. It just goes on and
Exactly.
on. You
Yes.
are. Well, it's interesting though that you bring that up. I don't know. Everybody's been bringing up my first book and I haven't thought about it in so long. And so that corner where I was standing is literally a block and a half from where I was getting my biopsy.
Hmm.
Um, and then eventually, though, I did get a second opinion at UCLA. And so all of my care ended up being elsewhere for breast cancer. But it was pretty uncanny to be in that similar place in those buildings, kind of having these traumas go on not too many years apart. When I was first diagnosed, I forget, I was waiting to see the first breast surgeon. And my husband and I were in the waiting room, and I started typing in my notes section of my phone. And it was the beginning, or it felt like the beginning of another memoir. Like it was like describing the light, describing my feelings, describing how, unfathomable this whole thing was. I have since decided that no, a memoir is not another thing I plan to do, but I mean, it could happen. Normalize It came to be because actually a handful of months after I was diagnosed, this publishing company that specializes in mental health came to me and they wanted me to write a book.
Mm.
And I liked the idea of sort of building on everything I had done previously. The thing is, people seem to think that I specialize just in miscarriage because I got on this soapbox about miscarriage and started this. I had a blah, blah, blah. Sorry.
It's okay.
Um, wait, what was I going to say? Oh, and that I started the I Had a Miscarriage campaign with my first New York Times piece in 2014, and then, got on Instagram and was talking all about miscarriage. So people came to see me, as an expert in that. But originally, when I started my private practice, I was combining my background in public health with my clinical skills. And I had envisioned specializing in the entire spectrum of women's mental health. So that includes pregnancy loss, but it also includes perinatal and postpartum mood and anxiety disorders, terminating for medical reasons, body image, motherhood related issues, all of that. So Normalize It includes it all. Mm-hmm. Normalize It is all about replacing the cultural silence with storytelling. It's a compassionate dare to all of us to really think about, how has culture impacted me in a way that maybe I haven't even been aware of? Why do I feel ashamed when I first got my period, for example, as a young girl? Or why is it that I felt a sense of self-blame when I experienced pregnancy loss? Or how is it that I expected my body, after giving birth to a live child, in motherhood, how could I expect myself to have a flat belly? So on and so forth. So the book encompasses everything from girlhood through menopause, because menopause, though now there are some great major books out about the topic, menopause is going to happen to all of us. Just like menstruation, I believe, happens to all of us, right? So it's like, how is it that we're not informed? How is it that we feel alone? How is it that we feel disgusting or aberrant or ashamed or quiet or, somehow invisible? And so this book is all about inviting people to speak what has been the unspeakable.
So the power of storytelling, you and I are on the same page. We both value it deeply. How do you feel like we can get these topics into a more daily conversation? Like, there are many times where I can sense like I'm in a group of people that would be shocked if I say IVF, or shocked if I say
Really?
hysterectomy, you know, because like who talks about those things? And like I just love saying them because I do want to normalize it,
I love that. That's
Because
great.
I'll be like, oh, that reminds me of my sixth cycle of IVF when blah 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 blah, because I want it.
Yes,
That to me is part of normalizing it. I love the
I know.
storytelling component, but like, how do we get it? Is it on us as women to like feel confident bringing it up? Because I don't think many
Mm.
people want to, and I don't blame them, but why?
But why? Right.
Yeah.
So it's like, my first thought when you said, how can we do this? It's like, well, you just told us how you did it. It's like,
Yeah.
by just saying it. But you're right, though, that for some women, the shame is so deep and dark and ingrained and historical, like maybe throughout their family or maybe just culture, or the mix of both, which would be, all the worse. But they may not feel like, ooh, I want to normalize this. Like I can take up space and say what I've lived through. They may not feel that they can. So the book sort of gets into, with these sort of fictitious patient examples, various ways that people can begin to scratch at that, to begin to think about sharing their story. So, you don't have to get on a soapbox. You don't have to give a TED talk about menopause, but you could,
Yeah.
you know, but another option could be you journal about it. It's about getting it outside of yourself where it festers. The silence festers to the point where I think that's where the incredibly unhealthy shame can come from.
Mm.
And so I do think even journaling about it, if somebody wants to post about it. I mean, what's interesting, so many people talk about how there's so much comparing on Instagram. And of course, we do see people in bikinis and, on vacations and things like that. But I don't know about you, but I feel like the pregnancy and infant loss community and the fertility community, it's like there's so much love and support and community there and
Yes.
so much openness, you know. So even if it's somebody daring to post about what they've been through, that could be enough. So I think it's going to start with how we raise our girls and our boys,
Mm.
right?
Yeah.
Helping them feel comfortable in their skin from the get-go, helping to normalize talking about hard things.
Mm.
Because I do think that, especially with girls, I mean, well, and boys, but girls are told, like, keep a smile on your face, don't talk about the symptoms of menstruation, just suck it up and get through the day. And boys are told don't have emotion at all, and
Mm.
like, so they may not even feel like they can cry if they want to express something. So all of that is problematic. If we can work on this in very subtle or demonstrative ways with our children, with ourselves, I think we can do something. Like, I think culture wants this. I think people are begging for it. And I mean, we see it, I mean, the Me Too movement, like we see these big movements trying to upend this antiquated silence and to replace it with booming, important stories and voices.
Mm.
So I'm
Are you
hoping the book does that.
I hope it will. I think it will. I mean, the title is incredible. Normalize it. It's just so universal. Everyone wants, every woman, yes, there it is. Every woman, I mean, of course, men too. I don't want to generalize, but every woman wants to normalize so many things that they don't feel like they have permission to normalize. Will you give us a glimpse into your life about how you do talk to your children about these things, or any particular moments you can think about? Do they ask, or when did they first ask about miscarriage? I can tell you personally, my children just asked me at 6 years old if they're rainbow babies.
How do they know?
YouTube is now banned in our home on the television because, and I'm not mad at it, but there was like an image of Bluey. So they went to it, and Bluey does make reference to miscarriage several times that I've noticed. Yes. And I'll
Oh,
send you this actual YouTube link. But
wow.
this particular YouTube link is for adults. And it's an adult talking to other adults about all the times in Bluey miscarriage is mentioned and proof that Bluey is a rainbow baby. Yeah,
Fascinating. I
I
mean, but
know.
in some ways I'm relieved. I mean, like, talk about normalizing it. I mean, at least they're acknowledging
I mean,
that not every pregnancy works out.
totally. And they show a scene where Bingo, the younger sister, puts a balloon under her belly, I mean, under her shirt for a skit they're acting out, and the balloon pops and falls out. And
Oh,
they
wow.
cut to the parents in sadness. And so
Oh, geez.
I
Okay,
know. So
that's
that's a
intense.
lot. Like,
That's a lot.
wasn't expecting my 6 year olds to ask me about that. And I kind of love that it was out of my control. And we talked about it. And I was
Mm,
like, yeah, you are rainbow babies. And what does that mean? And like, they've,
wonderful.
yeah. So, like, in some ways, and especially listening to you say the way we have to be about this with our children, I'm like, wow, I'm actually relieved that they asked. And it's not hanging over me. Like, when will I
Yes.
tell them?
Yeah. So what did you say? Like, how did you explain
So they were like, "Are we rainbow babies?" I don't think they were expecting me to
it?
say yes. And I was like, "Yeah, you guys actually are rainbow babies." And they were like, "What? You mean we had a brother or a sister?" And that's when it got really complicated
Yes.
because we do bite-sized pieces, as you know, at the
Yes.
age level for which it feels appropriate. And I was like, well, babies start from very, very little cells all the way until they grow to a baby, and they hadn't grown into a brother or a sister. We don't know what it was. We don't know. It was just a pregnancy, and mommy and daddy were really hopeful that it was going to turn into a baby, and it didn't. And we're really glad now that it didn't, even though it was torment to go through because we got you,
Oh, that's
right? Like
profound.
I
That's
mean, this was the best we
beautiful.
could do. We also then told them that like we trust them with this top. By the way, why am I talking on my podcast? But we
No, no, I want to hear this so badly because it's
we
so important.
we told them that like we trust them to understand this stuff, and it's a big conversation that not all kids do talk about this with their families, so they shouldn't like hang out at the schoolyard talking about rainbow babies.
But maybe
And
they should.
or maybe they should. Well, they the next day my son came home. They both came home and my son was like, I was a little sad today, and when one of my friends asked me why, it's because I told them my baby brother died.
Oh, wow.
So, there's finesse that has to
Yes.
happen. And I'm like, great. Now
Yes.
this kid probably went home and told their parents, my best friend lost a baby brother, and they think that we lost a bit. It gets very big.
True.
But I'm like, that part is not in my control. The part that's in my control is what I tell my kids.
That's
And
true.
they sometimes
Right.
think, oh my God, there could have been four kids in this family. Like, no, you don't get it. You wouldn't have been here. You
Exactly.
know?
That is so funny. That's in my first book because
Yes.
my son says to me, so then you would have had three children. And I'm like, no, your sister wouldn't be here had I
Yeah.
not had the miscarriage. So
Right.
it's
It's
funny. Well,
that piece of the concept I understand could be very hard to understand for them.
definitely,
Yeah.
definitely.
Yeah. So when do
Wow.
you
Good on you.
remember talking about it because your son's older. So did you talk about it with him early on? Did he ask? Did he know?
I remember that. So he was about just over three when I had my 16-week loss. And we consulted with the pediatrician because, I don't work with children in my practice. So I just wasn't sure exactly how to put it. I have a small frame. So I was so obviously pregnant, but we hadn't been talking about it with him. But my patients all knew it was just, I was, 4 months along. What we decided to say to him was we thought mommy was pregnant, and it turns out she's not.
Mm.
He was three. I mean, it was
Yeah.
just, I don't, introducing the concept of death, I
Hmm.
thought would be too complicated and too scary. I didn't want him to somehow think that he could die or that I could die or like that babies in general could die.
Right.
So it came later. It
Hmm.
came later. I don't remember exactly how many years later, but I believe my daughter was probably around one when we had a conversation about the miscarriage, and because he had sort of weighed in on what he wanted a baby sister's name to be, and then we
Hmm.
ended up giving that name to our lost daughter. I
Yes.
didn't I didn't give a name to her for several years, honestly, after the loss, but it just felt appropriate and important at some point. Yeah. So, and my daughter
It's a
knows
beautiful
as
name
well.
too. It's a beautiful
Olive.
name. Yeah. I love that
Yeah.
name. Yeah.
Thank you. And yeah, I like it for the deeper meaning of it as well. So, and my daughter knows that not all pregnancies work out. I
Hmm.
think that's the thing. Kids are learning in school how to prevent pregnancy, STDs, condoms, like all this talk. I mean, obviously yours aren't yet, but
Right.
eventually. um, why are we not also mentioning that not all pregnancies work out? And
Hmm.
actually that for some getting pregnant is difficult, or staying pregnant is difficult. That could be integrated into a curriculum in a very subtle way that I think would again normalize the fact that this is happening to 1 in 4 women or 1 in 6 women or one in
Hmm.
160 women,
Hmm.
just all the various statistics around fertility, miscarriage, stillbirth, all of it.
Mm. I hope that happens. It's
It
probably
won't.
yeah, it won't. I mean, it's definitely too late. Like your kids are older, so it won't happen in your kids' generation, but maybe there's a chance for my kids or their kids.
Yes, I mean, and we could be the change. Like
That's
I
right.
do, I wonder if that mom reached out to you, if that kid went home and told his mom,
She didn't, and which is
okay,
by all means fine. And I felt especially badly about it because it's again not in my control, but she just had a second baby. And I
okay.
think there might have been some issues between the first and the second. And she literally, I mean, like within the week that this happened, she had maybe had a 2 week old baby. So I'm thinking to myself, I mean, I don't know. I'm all guessing and
Oh,
making up stories in my head. I'm assuming that the kid went home and told her mother, and she also is a different culture than I am. She doesn't speak great English. So
I see.
complicated, but also profound when you think about it, because I think to myself, my son's friend, she's going to remember that forever. She's going to remember when he told her, if she went home and talked to her mother about it. And that is
But
going to
that's the
inform,
thing.
yeah,
But that
exactly.
promotes conversation. So I think, I mean, I love this. I
Yeah,
think this is kind of where it all begins. And I think it is interesting. Like, do we tell our kids, like, ooh, this isn't something to like talk about on the
right.
playground, or do we just kind of leave it and see what they do with it? Because I think you have an instinct that that woman's baby is a rainbow baby too.
Right, right.
So then maybe she begins to explore what that's all about. I mean, who knows?
Who knows?
But
But
I like
it's,
the idea of the
yes,
proliferation of
yes.
storytelling, through these little people and through us as well.
I mean, I was blown away by the conversation with my kids about it, really blown away. So
I think
there's
that's
value
so
there.
important. Yes,
Definitely,
for sure.
definitely. How did you in normalize it? You break it down into like on body image, on shame, on sexual trauma. Was it hard to pick those topics for you? Did you know, like, did you have to cull it down? How did you determine which things you wanted to go into?
I think I tried to cover everything that was sort of what I see as reproductively informed. Like,
Mm,
because that's my specialty area, I thought, menstruation through menopause, like what our
hmm
bodies go through, you know. However, we actually also included that the publisher thought it was important to include friendships, divorce,
mm,
um, intimacy, relationships. So it's sort of, I think, the whole kind of not the whole life spectrum, because menstruation, I mean, menopause, of course, is not the end of life, but like I think we tried to cover all the major milestones that are things that women potentially go through in their lifetime.
really good. Do you feel is your life different since your cancer diagnosis? Do you eat differently? I mean, from the small things, do you eat differently? Are you fully in remission? Like, how do you manage this moving forward?
I really appreciate you asking me these things. No,
I hope
because
so.
nobody does. I mean, it's interesting. I mean, and I get it because I'm known for the miscarriage book and miscarriage in general. And so I think that for some people in my Instagram community, like the breast cancer diagnosis was inconvenient for them because they were
Mm,
not getting new content from me for a
right,
while about the topic they were there for.
right.
Um, so people don't really ask me. I do not eat differently. I do, I have a gene. It's not the BRCA gene. It's one that people haven't heard of. It's called CHEK2. It's on my dad's side of the family, but again, no other women in my family have had it. So I honestly, just like with my miscarriage, when we found out there was a chromosomal abnormality, I was actually relieved to know that I had a genetic issue, even though unfortunately it potentially exposes me to other issues as well.
Mm,
But it stopped me from going to any places of potential self-blame or shame, or what did I do wrong, or did I eat too much of this or not enough of that, or any of those types of things. Um, you know, I wish that I were able to be even more aware on a daily basis of how lucky I am to be here. Because I think for a while there, I really was. I mean, it was like the emotion of every day and like looking at my children and thinking, will I remain and what's going to happen? And, those are the early days, of course, of diagnosis and even the first surgery. But time passes and I'm sort of quote unquote like back to myself, whatever that
Hmm.
means, a totally different version of myself, but just like it's not in our daily lives anymore, luckily.
Hmm.
And with the question about remission, I don't know how to answer that. I mean, my oncologist says that I'm cancer free, but then another oncologist says she never says that because there's no way for any of us to really know that. But I mean, I went through all the treatments and I'm done. I do take tamoxifen, which is an estrogen blocker
Hmm.
because of the way it affects my sleep, and it's not pretty. But if it's a lifesaver, then I'm sticking with it.
Great. Did people, I mean, obviously we're not going to disclose any of your patient relationships, but do you feel like because people reach out to you specifically because of the reproductive component of your work, do you feel like people started to reach out to you more with a cancer lens? Shit, I'm freezing.